Welcome to the Neurology channel, your trusted source for information on neurological treatments and brain health. Today we have an important topic to discuss: haloperidol, commonly known as Haldol, R. Whether you're a patient, caregiver, or simply interested in neurological medications, you're in the right place. Don't forget to subscribe and hit the notification bell for our latest updates. Haloperidol, sold under the brand name Haldol R, is a medication widely used in the field of neurology and psychiatry. In this video, we'll explore what haloperidol is, how it works, its applications, and why it's significant for patients with neurological and psychiatric conditions. What is haloperidol, Haldol R? Let's start with the basics. Haloperidol is classified as a typical antipsychotic medication. It belongs to a group of drugs that are primarily used to manage psychotic disorders and other neurological conditions. To understand how haloperidol works, we need to delve into its mechanism of action. So, how does haloperidol work? In the brain, there is a neurotransmitter called dopamine, which plays a crucial role in regulating mood, emotions, and perception. Dopamine acts by binding to specific receptors in the brain, known as dopamine receptors. In certain neurological and psychiatric conditions, there can be an imbalance in dopamine activity. Excess dopamine signaling can lead to symptoms like hallucinations, delusions, and agitation. Haloperidol works by blocking the action of dopamine on its receptors in the brain. Haloperidol is classified as a dopamine receptor antagonist. It competes with dopamine for binding to these receptors. By blocking dopamine receptors, haloperidol helps reduce the excessive dopamine signaling that contributes to psychotic symptoms. Why is haloperidol, Haldol R, used in medicine, especially in neurology and psychiatry? In the brain, there is a neurotransmitter called dopamine that plays a central role in regulating mood, emotions, and perception. Dopamine is involved in various brain functions, including the perception of pleasure, reward, and motivation. Dopamine exerts its effects by binding to specific receptors in the brain, known as dopamine receptors. These receptors are classified into several subtypes, including D1, D2, D3, D4, and D5. In certain neurological and psychiatric conditions, there can be an imbalance in dopamine activity. Excess dopamine signaling, particularly through the D2 receptors, is associated with symptoms such as hallucinations, delusions, and agitation. Haloperidol works as a dopamine receptor antagonist, specifically targeting D2 receptors in the brain. It competes with dopamine for binding to these receptors and effectively blocks their activation. By blocking D2 receptors, haloperidol helps reduce the excessive dopamine signaling that contributes to psychotic symptoms. This action is crucial for managing symptoms like hallucinations, delusions, and thought disorders in conditions like schizophrenia. Haloperidol is primarily prescribed for individuals with psychotic disorders, especially schizophrenia. It helps alleviate or control the severity of these symptoms by normalizing dopamine signaling. Administering haloperidol, Haldol R, requires careful consideration. Haloperidol is available in both oral and injectable forms. The choice of formulation depends on the patient's condition and the need for rapid symptom control. It's important to note that while haloperidol can be highly effective, it may also have potential side effects. Healthcare providers closely monitor patients for extrapyramidal symptoms. These are movement-related side effects that can occur with antipsychotic medications. They include muscle stiffness, tremors, and restlessness. Cardiovascular effects. Haloperidol may cause changes in heart rate and blood pressure, especially at higher doses. In conclusion, haloperidol, Haldol R, is a significant medication in neurology and psychiatry. Its ability to block excessive dopamine signaling in the brain helps manage psychotic symptoms in various conditions, ultimately improving the quality of life for patients. Thank you for joining us on the Neurology channel. If you found this video informative, please give it a thumbs up, share it with others who might benefit, and don't forget to subscribe for more valuable insights into the world of neurology and brain health. Stay well and take care.